Today, we're going to talk about a form of OCD that often goes misunderstood, harm OCD. If you or someone you know struggles with distressing thoughts about causing harm to others or yourself, this video is for you. Harm OCD is a subtype of obsessive-compulsive disorder where the person experiences intrusive thoughts, images, or urges about causing harm. These thoughts can be terrifying and often feel completely out of character for the person experiencing them. It's crucial to understand that having these thoughts doesn't mean you want to act on them. In fact, the very fact that they cause so much distress usually means the opposite. For example, someone with harm OCD might fear that they will hurt their loved ones, even though they deeply care about them. These thoughts can be about physically harming someone, but they can also involve fears of emotional harm, like saying something hurtful or causing psychological distress. People with harm OCD often experience intrusive thoughts. These are unwanted, distressing thoughts that pop into your mind unexpectedly. They might involve graphic or violent scenarios, which can be incredibly upsetting. Compulsions. To cope with the anxiety these thoughts cause, people with harm OCD might engage in compulsive behaviors. This could include mentally reviewing their actions to ensure they haven't hurt anyone, seeking reassurance from others, avoiding certain places or people, or even mentally neutralizing the thoughts. Avoidance. Many individuals with harm OCD will go out of their way to avoid situations where they fear they might act on these thoughts, even if they've never acted on them before. It's important to remember that the core issue in harm OCD is not a desire to harm others, but rather an overwhelming fear of doing so. The thoughts are ego-dystonic, meaning they go against the person's values and beliefs. This is why they cause such significant distress. If you or a loved one is struggling with harm OCD, it might be worth trying one of our self-help courses at impulsetherapy.com. Created by OCD medical specialists, specifically for those suffering with OCD, over 97% of our users who have completed the course have seen a reduction in OCD symptoms. You can find out more at impulsetherapy.com. The good news is that harm OCD is treatable. Here are some common and effective approaches. Cognitive behavioral therapy, CBT. The most effective treatment for harm OCD is a specific type of CBT called exposure and response prevention, ERP. ERP helps individuals gradually face their fears in a controlled way while learning to reduce the compulsive behaviors that follow. Over time, this reduces the power of the intrusive thoughts and the anxiety they cause. Medication. Some people find that medication can help manage the symptoms of harm OCD. Selective serotonin, reuptake inhibitors, SSRIs, are commonly prescribed for OCD. These medications can help reduce the intensity of intrusive thoughts and compulsions. Mindfulness and acceptance techniques. Learning to observe your thoughts without judgment or reaction can be incredibly helpful. Mindfulness-based approaches encourage individuals to accept the presence of intrusive thoughts without trying to push them away or act on them. Support groups and therapy. Talking to others who understand what you're going through can be very reassuring. Whether it's a support group or one-on-one therapy, connecting with others who share similar experiences can reduce feelings of isolation and provide valuable coping strategies. If you're struggling with harm OCD, it's important to remember that you are not alone and there is help available. The thoughts you're experiencing do not define you. Seeking professional help is a strong and positive step towards managing your symptoms and reclaiming your life. Thank you for watching, and remember to subscribe for more information and support on OCD and related topics. Together, we can break the stigma and support each other in living well with OCD. If you found this video helpful, please give it a like and share it with others who might benefit from this information. Your mental health matters, and we're here to support you every step of the way.